The liver is the only organ that can regenerate and heal itself. However, its functions can be brought to a halt with the scarring of the liver, which is irreversible. The good news, though, is that there are healthy interventions and measures that can be applied, all the while maintaining a healthy liver and a healthy body overall. Welcome to the program today as we zoom in on liver cirrhosis. My name is Bill Hawaka, and here's a preview of what is ahead.
One leg, yes, 2, 3, give me 4 more, 4, 3 more, 2 more.
Liver cirrhosis refers to scarring of the liver and poor liver function, which is usually seen in terminal stages of a chronic liver problem.
Fast foods, many people are taking fast food nowadays because of what you call the cravings.
Yes.
But we're able to address that. And for the case of Alice, of course, she needs to make sure that she gets rid of the fast foods because they have too much saturated fat.
Without knowing the detailed implications of liver cirrhosis, it is so easy to be complacent about our precious health, sometimes with devastating consequences. We talked to the members of the public to find out how much they know about the liver as an organ of our bodies.
Excessive drinking of alcohol can cause liver failures. Some are genetic. There's some kind of diseases, like let's say cancer and what, can cause liver infection and maybe failures. Yeah, those are some of the few I know.
One of the things that I know about liver cirrhosis is that, one, it is non-communicable. It affects the liver. And mostly the people I've heard that have such diseases are people who take drugs such as alcohol. So over excessive use and long-time use of alcohol subjected them to such a disease, liver cirrhosis.
It's a disease that attacks the liver, and this basic knowledge that I know about it is that people who drink alcohol mostly are the ones affected by liver cirrhosis.
Well, I have heard of it, but I have not had time to concentrate much on knowing what exactly, how it affects our lives.
Liver cirrhosis isn't curable, but it's treatable. Doctors have two main goals in treating this disease: stop the damage to your liver and prevent complications. We talked to a clinical officer, Irene Alco, who shared the following information with us.
Liver cirrhosis refers to scarring of the liver and poor liver function, which is usually seen in terminal stages of a chronic liver problem. So a person who suffers from liver cirrhosis may have many symptoms because as it comes as the late stages. So before you can say you have, in the initial stages in diagnosis of a patient with liver cirrhosis, most of the time you might have loss of appetite, you might have nausea, weight loss. In liver cirrhosis, most patients have weight loss. They might have jaundice, which is the yellowness of the eyes, and if you are very light, you'll be able to notice it on the skin of some patients. Some patients might have nose bleeding. They might have itchiness of the body. Someone might look at a patient and have a lot of scratch marks. What we have, anorexia. Patient eats and does not vomit. Some patients might have general body weakness. They're just tired, general tiredness. But in severe cases, because of the complication, patients might have confusion. Some patients might have vomiting blood. Others, especially for men, they might have what we call gynecomastia, breast enlargement in male patients. In severe cases, also we might have some leg swelling. Patients have present with leg swelling, abdominal distensions. Also, in such patients, if you look on the skin of such patients, you might have like spider-like arteries under the skin, just underneath the skin, what we call the spider nervi. In male patients or In male clients, they may have testicular atrophy. This is where the testes shrink and loss of libido. Might be complaints. Some patients may present with loss of libido, so it's good to check if they have liver cirrhosis. The commonest predisposing factor is alcohol, but we have certain illnesses like hepatitis B, we have hepatitis C, we have some damage to the bile ducts, which may cause a person to have liver cirrhosis. We have some autoimmune diseases, which may predispose somebody to have liver cirrhosis. Obesity also. You might ask, how does obesity, especially for those patients who go for gastric bypass surgery, they tend to have some patients have been reported to have liver cirrhosis. Some drugs also predisposes you to liver cirrhosis, like acetaminophen, which is Panadol. We also have some drugs which are used for chemotherapy, like methotrexate. Such drugs predisposes you to have liver cirrhosis. And last, we have the patients who have disorders for what we call iron, who cannot tolerate iron and copper. So such conditions such as hemochromatosis predisposes you to have liver cirrhosis. The treatment of liver cirrhosis depends on the causative, what has caused the liver failure, the liver damage. Treatment will depend on what has caused the liver damage. We said for alcohol, the treatment of alcohol is stop drinking. If it's hepatitis, we have hepatitis B. We have treatment for hepatitis B. You can put the patients on antivirals, because hepatitis B is a viral disease, so you can be put on antivirals. Also hepatitis C, there's treatment. We have the centers which treat hepatitis C. If there are biliary disorders, we have seen patients who have biliary disorders, the bile duct have a problem, going for surgery, like biliary stenosis, they go for surgery and it's corrected, so it can be corrected. So treatment of liver cirrhosis depends on what has caused the liver damage. In some patients who have liver cirrhosis, liver transplant can be done. Some of these drugs, especially for treatment in hepatitis B and hepatitis C, some of the drugs have some side effects. So we might have a patient, like for hepatitis B, we have to monitor the kidneys, because like tenofovir, which we are currently using for patients with hepatitis B, has the potential of causing some kidney problems. So a patient may come with some nausea, vomiting. So you might not know if it's the liver problem causing all the drugs, but some of these drugs include nausea, vomiting, abdominal pain. And if you look at some of these tests, you can be able to know and see if the kidney has been affected. For patients with liver cirrhosis, we have to, before we say prevention is better than cure. So to avoid getting liver cirrhosis, there are things we always say for prevention. What can be done is, like, 1, practice safe sex to reduce the risk of getting such illness like hepatitis B and hepatitis C. Hepatitis B and C can come through blood transfusion and through sex. Also, for patients, for people who are at high risk of getting hepatitis B, especially for health workers, there is vaccination for hepatitis B, which we call the Heparix, which is essential. So for healthcare workers, it's advised to get the hepatitis B. For obesity, you need exercise and more of nutrition. Nutrition is follow-up. So it is good to be active, to ensure your weight is within the normal. So for patients who are obese need to work up and work out. And also it's been found, the WHO also says, when you eat a balanced diet and being active, it reduces, it slows down the progressions. When you have hepatitis, it slows down the progression to liver cirrhosis. The WHO report, which is the World Health Organization, reports that 20 to 30% of patients with hepatitis B will progress to liver cirrhosis. In conclusion, liver cirrhosis, we can prevent liver cirrhosis, especially for those who drink. Reduce your drinking or stop at all. And for all people who are at risk of getting hepatitis B and C, let's go for vaccination, especially at those with risky behaviors, go for vaccination.
The liver converts the food we eat into stored energy. In layman language, whatever we put in our body at some point has to get filtered through the liver, and this is why our diet can play such a large role in the development of liver cirrhosis. We talked to a nutrition expert who enlightened us with the following knowledge. Greetings, welcome to Health and Flavor. We have reached our nutrition segment, and on set we have Mr. Kefa Nyanumba. He's a nutrition expert. Actually, I like to call him a guru because of his expertise. Welcome to this segment. We'd like to look at today's case study, is liver cirrhosis.
Yes.
And our patient by the name Alice. Yes, and that's not our patient's real name. So she's a 65-year-old lady, and she came to you with some complaints. That was some jaundice.
Yes, which is actually yellowing of the skin.
All right, itchiness.
Itchiness, yes. And lack of appetite.
Okay.
And, this is actually one of the conditions that usually affects, us. And many people don't actually seem to realize that everybody has one liver. Yes. And meaning that we did need to make sure that we take good care of it. Sure. Because we don't have a liver transplant. Yes. Yeah, so when there is any issue in the body, usually our body sends us signals. And those are some of the symptoms that Alice was complaining about. Yeah. Yeah, the lack of appetite, fatigue, yellowing of the skin, itchiness. And most of these symptoms are actually some of the symptoms that are going to assist us to know when there is improvement. I mean, with time, where she should be able to, for example, get improved energy and all that after the intervention.
So then we start with her dietary history. Yes. We learned that she takes a lot of fast food.
Yeah, fast foods. Many people are taking fast food nowadays because of what you call the cravings. Yes. But we're able to address that. Oh. And for the case of Alice, of course, she needs to make sure that she gets rid of the fast foods because they have too much saturated fats.
Fast food like potato chips,
yes, French fries, donuts. All these foods actually increase the risk of getting a condition we call fatty liver. Yes. And once somebody gets that condition, of course, the risk of getting high cholesterol levels usually increases. Yes. And that tends to compromise the management of liver cirrhosis. Oh, okay. Yes.
So then I can also see that she takes alcohol.
Alcohol, of course, for the people who take alcohol, we say avoid. Yes. Because alcohol overworks the liver, because the liver has to get rid of it. And I would actually advise that Alice avoids alcohol. Yes. Yes, because number two, it also, dehydrates the body by interfering with the production of hormones that assist to balance fluids in the body. So she needs to stop alcohol. I see that she rarely takes fruits, and also when it comes to water, hardly takes water because she doesn't like the taste of water. Yeah, many people don't take water because of what I would actually call electrolyte imbalance. All right. Yeah, and that's why you find a number of them actually going for flavored water from the supermarket, which has a bit of calories compared to the pure water. All right. So you could actually advise people to go for the pure water. I know there are a number of people sweeten their water, let's say with lemon, etc. Yes. But it's important for us to address the root cause because you should be able to take the normal water. Okay. Now, in the case of Alice, of course, water intake is very, very important because, it's going to assist the liver in terms of its functioning. Yeah, so she needs to increase her water intake. Okay. She needs to target the 1.5 to 2 liters per day. All right. Yes. So, again, we see she rarely takes fruits, and we have some fruits here. Yeah, fruits are very important, not just for children, but Even for adults.
Yeah.
I know there are people who think that fruits are supposed to be for
fruits
children.
are meant for children.
For children,
fruit
yeah.
salads.
We all need fruits because they assist in terms of boosting the immunity.
Yes.
And in the case of Alice, of course, she needs to make sure that she increases her fruits because our immunity needs to be strong.
Okay.
Yes, and that is something that God gave us free of charge, and we need to make sure that we boost our immunity.
All right.
By taking, some of these fruits. For example, we have the oranges.
Yes.
They're very good for vitamin C, which is an important nutrient when it comes to immunity.
Yes. And the
yes, pawpaws are actually very good for our digestion.
Yes.
Yeah, remember when you take any food, digestion has to be efficient
Sure.
before you get the nutrients.
Yeah.
So pawpaws are actually very good. And of course, we have other fruits like green apples, which can be taken as part of our snacks.
Okay.
So fruits are actually very important for adults and of course for all of us.
So when it comes to apples, is there does the green apple have advantage over the red apple or the pink apple?
The difference is in terms of what you call the sugar content.
Okay.
Yeah, the sugar content. Green apples, tend to have what you call a low glycemic index.
All right.
They don't affect our sugar or spike our sugar that fast.
All right.
Yeah, so they're good.
Okay.
Yes.
That I didn't know. Thanks for that tip.
Yeah.
Then we look at some vegetables that you have prepared for us.
Yes.
So with this, see, this is a vegetable salad.
Yeah. This is a
Meant to be
vegetable salad.
taken raw.
Yes.
So what if I would just like to put this in a cooking pot and have this eaten when it's cooked?
Okay, it's usually very, very important for us to make sure that at times we take some raw vegetables because when we cook our vegetables, at times we interfere with the water-soluble nutrients like vitamin C.
Yes.
Yeah, so at times we also need to get some of the vegetable salads like these ones as part of our meals.
All right.
Yes.
Okay.
Yeah.
And so then when it comes to water, we still insist that it has to be 2 liters.
Oh, yeah. Which is just the average, but that usually depends on the body weight. When people come to see us in the process of designing their nutrition program, of course, we give them the exact amount of water they need.
Oh.
But water is very important for everybody, actually.
Okay.
Yes.
So with the depending with the intervention, so the water intake can the water intake for someone with liver cirrhosis have to be increased?
Yeah, because this somebody first and foremost who needs to increase exercise,
all right,
so that the body fat can actually come down.
Okay.
Because from the processed foods, it's obvious that her body fat will be on the higher side, so she needs to increase exercise. And from the dietary history, you would be able to see that activity level was actually on the lower side.
Yes.
So the water intake actually needs to increase.
Okay.
Yeah.
And when it comes to the avocado, I've heard you saying in our previous
conversation,
yes, that it helps with it has
management. Good fats. It's actually as the fats we call unsaturated fats.
Yes, so
which are very good actually.
Is the avocado the only kind of, what other sources can we get good fats from?
There are many sources of unsaturated fats, especially the seeds. And you see, there are many people don't take seeds, but seeds is actually very good. Yeah, when it comes to unsaturated fats, we are talking of seeds like pumpkin seeds, for example.
Yes.
The chia seeds.
Yes.
Yeah, sesame seeds.
Yes.
All these seeds are actually very good for us.
Oh,
they can be taken as part of our breakfast, as part of our snacks.
Yes.
etc.
All right.
Yes.
So then that's one way to replace the...
In the case you don't access the avocado, those are the other sources of the good fats.
All right.
Yes.
Those are some of the things maybe she can replace with the deep fried foods.
Deep fried foods.
With the high cholesterol
Yes.
Okay.
Yeah.
All
Those ones can really assist.
So then, unfortunately, we've come to the end of this segment.
Thank you so much.
Thank you so much for your time. And for our viewers back at home, thank you so much for your time. Up until next time, from us here, it's goodbye.
Bye.
While bed rest is very important for patients with liver cirrhosis, more physicians are identifying the value of exercise for their liver patients. This points to better blood oxygenation and improved prognosis as reason to endorse regular exercise as part of their treatment program. Our fitness expert gave us the following advice. Hello everyone, welcome to Health and Flavor. This is the fitness segment, and today we're going to focus on liver cirrhosis. The exercise that we're going to do today are going to be focused on this disease. But remember, back at home, these exercises are meant for everyone. Today we have Mr. Nzuki, a fitness expert, who's going to take us through these exercises. Hello, how are you?
I'm fine, Billa.
Good to see you again. Good to see you. I'm fit because we can see. So tell us, liver cirrhosis, these exercises, how are they helpful to someone who is suffering from liver cirrhosis?
Exercise majorly, in exercise, it helps in weight management.
Oh, weight management.
Yes, and you know, in weight management, that's why we have the insulin, which brings issues to the liver.
All right.
Yeah, so when someone is exercising, it increases his or her metabolism.
Okay. All right. So for people with liver cirrhosis, more exercises increases the metabolism, and that makes them better, healthier, stronger. Yes. I get you. So now, what are the exercises that you have for us today? I am ready to go.
Yes, for today,
Yes,
we'll use the skippy rope, but not for cardio.
Okay. Okay, so then we are using the rope this time differently. We are folding it up twice. Huh? Okay. Why are we doing this? What is this meant for?
We are doing strength workout.
Okay, strength workout.
Yes, so you pull it. Yes, to the maximum. And then you squat, then you pull. Feel it on your shoulders. You feel it. Let's go. Several times.
Okay.
Squat. 2 more. 1 more. How was that?
Wow, that is really a strength workout.
Maximum. No, one side. One side.
Just on one side.
Yes, one leg. One leg. Yes. 2, 3. Give me 4 more. 4, 3 more. Let's change the other side. 4 more. 2 more. 1 more. Good. You go on our knees. Then you bring it here. Then make yourself comfortable. Make yourself comfortable. Look for your balance. Take care. You can also roll. Around. Let's go around. Around. You should get the balance whereby you lift your legs up and your arms up, and then you just relax there.
So, viewers, be prepared for a deep breathing exercise.
Watch, my stomach is bulging out and my shoulders are not moving up. No. Okay. Okay, watch me. The best way to do it, try it. Don't move your shoulders. Don't move your shoulders. I know it does not just come one day. I have done it again and again and again. While you are learning, the best way is to lie down. Just watch me. So as I do it, my chest should not be going up. It should only be the time it is going up.
Okay.
Yes, watch out.
So then let's
You got it? I try one. I know you are learning. Don't worry of making a mistake. Yes, I have you at home. You're also learning. When we are doing the deep breathing exercise, you always inhale with your mouth closed, and you exhale with your mouth like this. This is what I mean. Let's try it.
All right, thank you so much, Mr. Nzuki. Thank you so much for your time. I've enjoyed this. I hope viewers at home, you have enjoyed this. One thing I've learned is how to breathe in and breathe out. I never noticed that when we breathe in, we breathe the shoulders up. That's one thing you can keep in mind at home, and remember to always hydrate as you exercise.
My name is Dr. Fisa Zagai. a general surgeon, a public health specialist. Liver cirrhosis is the final stage of chronic liver diseases. It takes years or decades for chronic liver diseases to become cirrhosis. There is no cure for cirrhosis. The best way to prevent it is to diagnose and treat the chronic liver diseases. There are some lifestyle choices you can make to help prevent this potentially fatal condition. Number one, stop drinking alcohol. Alcohol damages or destroys liver cells. Consuming too much alcohol causes your liver to swell. Over time, this leads to cirrhosis. Number two, protect yourself against hepatitis. The most common type of viral hepatitis are hepatitis A, B, and C. Chronic hepatitis B and C can cause liver cirrhosis. Unprotected sex and intravenous drug use increases the risk for contracting hepatitis. Number three, eat a healthy, balanced diet of fruits, vegetables, whole grains, low-fat dairy products, and lean protein. Fatty buildup in your liver can cause non-alcoholic fatty liver, and that leads to cirrhosis. This is linked to high cholesterol, coronary artery diseases, obesity, and diabetes. Number four, get vaccinated against hepatitis B. If you work in healthcare or any other profession where you are exposed to hepatitis, you should consider getting vaccinated against hepatitis B. There is no vaccine for hepatitis C.
There you have it. A low-sodium diet, plenty of water, keeping fit, and regular medical checkups can keep liver cirrhosis at bay. There's nothing complicated about retaining your liver in good shape. It's all about a healthy lifestyle. There's a contemporary simile that says, as carburetor is to car, so is liver to man. I'll leave you to reflect on that one. I have been your host, Bill Hawaka. Thanks for watching Health and Flavor. See you next time. Bye-bye.